Hi, I'm Brian Gruber, founder of Integrated Orthopedics, and today it's that time of year again, high school football, so we're going to talk about common injuries and the reasons that we're out on the field covering high school football. Well, it really seems like the football season keeps starting earlier and earlier, so right now we're covering about 10 games. Starts anywhere, mid to late August and goes through the majority of October. I've been in the Valley for 9 years, and Ironwood was the first high school that I took care of, and I'm still the team physician for that high school. So we take care of high schools across the Valley, specifically Ironwood High School, Kellis, Greenway, and we have a strong relationship with Thunderbird High School as well. And we also take care of Arizona Christian University on Saturdays. The residency was at the University of Michigan, so I had the opportunity to take care of many of the Michigan athletes with football, hockey. I enjoyed the softball games, covered a lot of those tournaments. I covered many of the high schools in Michigan. And then when I went to my fellowship, I had the opportunity to take care of the what was then the St. Louis Rams, the St. Louis Blues, and we also took care of Washington University Athletics. So I've had a pretty good experience to have taken care of athletes sort of from the professionals to all the way down to the high school kids. The primary role really is obviously safety. We not only take care of the football players, but oftentimes we'll take care of patient or people in the stands as well as the cheerleaders. We're really there for primarily catastrophic injuries, which are exceedingly rare. For example, the injuries to the neck or the cervical spine, concussions, etc. Things that's the real reason that we're there. Certain things that you can see obviously are heat exhaustion, heat stroke. It's exceedingly important to stay hydrated, not only during the game, but the day of the day of participation, to make sure that the electrolytes are good. We see a lot of cramping. With the tonight, it's hot, and you'll see a lot of cramping, specifically for people that have not been well hydrated. Well, thankfully, the trainers that I work with are all very gifted and really have the athlete's safety in mind. The communication's wonderful. So an athlete will get hurt and they'll call, text me, or we'll get the athlete in the office. Oftentimes, it could be something as simple as are they going to be clear to play. So being able to have that communication with the trainers really expedites not only the care of the athlete, but also sort of like having the having the return to play as quick as possible. So we really see a vast array of injuries. Cramping is very common. Again, in the evening or the hot, in the heat, we see a lot of cramping, sprains and strains. So obviously a lot of rolled ankles. We see fractures. In football, there's a lot of hand fractures, so we'll see those. Some of the certain things that are important when we're out there, shoulder dislocations, for example, or something that can be reduced on the sideline. People can dislocate their fingers or thumb, elbows. So those are some of the common things that we might see on a Friday night. Some of the other things that we'll see, we'll temporize things. So say somebody had a fracture that might require surgery. That's something that you're going to put a splint on. The ambulance would come out, and we would put that patient on a board and take them to the hospital, for example. Concussions are common. We'll see, on every pretty much every Friday night, we see, or we'll evaluate at least a couple kids, and one or two of them will have a concussion. One of the biggest things now is with concussions, and it's been, over the last 10 years, we've really started to see an acute awareness of and being able to diagnose. And oftentimes, we're definitely going to keep the athlete, out of participation if we're concerned, about a concussion. So that's really become very, very important, as we've seen not only, in the NFL, but it translates all the way to high school athletics. So concussions, I think we're more aware. So I think the number of concussions is probably roughly the same as what it was 10 years ago, but it's being diagnosed more accurately at this point because, again, there's an acute heightened awareness of concussion. So there's a couple things that we're looking for. Number one, so if somebody says, they think they got their bell rung, they're going to be asked questions on the sideline. Is things of, vision, or do they feel sick? Can they remember things? There's a whole series of questions, the trainers, and we will ask the athlete. So that's one thing to determine sort of on field, on site, if an athlete appears concussed. And what we'll do preseason is there's different testing. One's called the impact test, where the athlete will answer questions on a computer or handwritten, and then for example, if somebody gets hurt on Friday night, they'll have their impact test within a couple of days to compare to their baseline, and they have to have accurate or improved scoring or to determine return to play and improvement from a concussion. There's really no leeway when we feel that somebody has a concussion. I mean, we'll definitely pull the athlete for their best interest. One of the significant challenges with concussion, for example, is if you have an athlete and you feel that they are concussed and you have to take them out of the game, oftentimes the athlete's very frustrated and really wants to go back into the game, and you really have to try to make it clear, not only to the athlete, but to explain to the parents what you're doing and why you're doing it, but that can be challenging. I think it's the camaraderie, as you get to know these kids over time, and as kind of the years march on, you not only get to know the kids, but the coaches and even the community, the fans. So it's fun, and it's something that I've done for a long time and will continue to do. My college teams clearly go blue, Michigan, and the pros. I'm still gonna go with the LA Rams because I was a St. Louis guy. They went to LA, so I'm gonna stay with them.